Probably better.
Okay, well, welcome everybody. And you've all heard that the meeting is being recorded. And welcome. And I saw at the December 16 meeting that there were, of the 28 registrants, there were 20 new attendees. So I'm hoping that maybe some of those folks are joining us tonight. And I really want to give a special welcome to Duluth Council Member Joe Cypress, if he's with us now, and also welcome again Osseo Council Member Juliana Holstrom, and they will share their thoughts and perspectives as City Council members on our resolution work, after which they'll take questions. And I mentioned that we did have a good turnout at the December 16 Special Advocates meeting. It was dynamic, a productive discussion with good Q&A chats. Thanks to Public Citizens Brittany Shanahan, who offered useful advice and resources, which is generating past resolutions throughout the country. And thanks again to Jerry Witt and Dave Garibaldi, whose leadership on the past resolutions in Duluth and Osseo show that it can be done here in Minnesota and is a boost to keep our campaign going and growing. The tactical value of the resolution is that it localizes the problem and solution, as expressed by Joel Cypress of Duluth, who said at their December 6th council meeting that the city budget is tight and property taxes are under pressure to sustain it due to underfunding of state aid to local government and the high health insurance costs for city employees. So without him pulling any punches, he went on to say what needs to be done and who needs to do it, because the resolutions ask not only for the council's endorsement of these measures, but for council members themselves to urge their legislators to support the measures. This gives less wiggle room for state legislators to say it's a federal issue or it's not a local problem. However, solving the problem of unaffordable health coverage is nonetheless a matter for government closest to the people. Getting city resolutions builds the political will for the Minnesota Health Plan outside the Capitol, which in turn builds the legislative will of the legislators inside the Capitol. Beginning with what some of us saw, I think it was 60 of us who saw this yesterday, the launching of the Minnesota Health Plan Legislative Caucus. So that being said, let's hear from Council Member Joel Cypress, who has to deal with the nitty-gritty of his city's budget to make it work in the best interests of his constituent taxpayers. So Joel, it's really great to have you with us tonight. And again, welcome.
It's great to be here, and I should let people know I am now a former city councilor. I chose not to run for re-election last year, so getting this resolution through was one of my final acts as a city councilor.
One of your final hurrahs. Well,
yeah, a few of the yeah, but
thanks for putting it to good use.
Yeah, and then I just first want to start out by really thanking Jerry Whitty, who just kept at us because I was working with Roz Randorf on our city council, and Jerry just kind of nagged us till we finally got it done. So Jerry should get a lot of credit for this. So thanks for having me, and it's great to see you, Juliana. I thought I'd just share a couple things about our experience in Duluth that I thought might be helpful in terms of the framing of the issue. And the first thing I'll say is we have an advantage in Duluth that we tend to be a progressive city with a progressive city council. I don't think there was any doubt that a resolution would pass. It was only a matter of by what margin, and our goal was to see if we could get a unanimous margin, which wasn't a sure thing because even though We tend to have a supportive city council. We've actually got, in terms of people's backgrounds, a fairly diverse city council. We've got a counselor who is a young guy who owns a bunch of local convenience stores. So he's coming from a small business perspective. I'm a public sector worker. We've got a management employee at Minnesota Power. We've got an accountant. We've got a counselor who drives for the transit authority and teaches yoga classes. So it's a pretty, a lot of different perspectives. And I think there was two things about how we framed it that are helpful. One is that, we got some of the sample language. I think it was sample language from St. Paul that may have been based on some sample resolution language that was generated by HCAM. But we kind of reworked it. And I don't know if people have seen a copy of the Duluth resolution, but the way we reworked it was to try to get away from like policy speak.
Yeah.
And to just frame the resolution in language that reflects how people actually experience the healthcare system.
Yeah.
Because I think part of the reframing we need is that we're always being put on the defensive to make the case for a single payer program, when in fact the current program is such a complete and total catastrophe that we need to frame this in a way to make sure that the defenders of the status quo have to explain themselves. Because if you think about how people actually experience the healthcare system these days, it's completely indefensible. And so just to give you a sense, I'll just share, I won't read the whole thing, but just like our first clause just sets the tone for the whole thing. Whereas the system of private health insurance in the United States creates financial and bureaucratic barriers that prevent individuals from obtaining needed medical care, drives up the overall cost of healthcare at unsustainable rates, and saddles individuals, businesses, and local government with unsustainable healthcare costs. And we just, very simple language. And you'll notice that each of those clauses is written in a way that it reflects how people experience the healthcare system. They experience the out of control cost. They experience the bureaucratic nightmares, the in-network, out-of-network craziness. And so we kind of took that approach for the whole resolution to frame it around the actual concrete, tangible, indefensible problems that the current system causes for people in their actual lives. So that'd be the first thing I'd share from the experience. Yeah. And I think that really resonated with the public, and it resonated with counselors across the political spectrum in Duluth, although we don't have any Republicans on our city council. As I said, there's some diversity in the experience of counselors, and you could tell that by using the language that everyone in that council, are the member of the council who's a small business owner. He, of course, is dealing with, benefits costs for his employees, but he's also someone who grew up in a low-income single-parent family, health issues in the family. So he's lived it himself, and he knows what it's like to be struck, so he's not necessarily ideologically, I'm for single payer, but when you just lay it on the line and say, yeah, what it's like to have to deal with this system, I think that resonated with him. And I think that's also a way to get away from it being seen as a partisan issue. We're talking about this in a way that resonates with what everybody experiences. Because everybody's got horror stories. The only people who don't have horror stories are either, independently wealthy or don't have health problems. And that's like very few people. And then the second one, and I guess the one you really asked me to emphasize, is that we put a big emphasis in our resolution and a big emphasis in our framing at our city council on the impact it's having on local government finance. And Roz and I actually timed the introduction of our resolution to coincide with the annual budget process. Duluth has been dealing with, for several years, we had double-digit cost increases for employee benefit costs for city workers. It's putting huge strain on our city budget. It's driving tax increases. I've made this point every single year, I think, for the last 6 years on the city council. Every year at budget time, I call people's attention to the drivers of the property levy increase, which is mainly the underfunding of local government aid and out of control healthcare costs. And so I become like this broken record every year, like just educating the public and like really emphasizing to my colleagues on the council that this is going to bankrupt us all if we don't get a handle on this. So in the case we made for it, both in the wording of the resolution and in the way we presented it at the council and in some of the media work that we did, we just really emphasized that this is no different, that the city council, passing a resolution like this, asking our legislative delegation to support the Minnesota Health Plan is literally no different than when we pass a resolution asking our legislative delegation to fully fund local government aid, or when we ask our legislative delegation to support bonding for a local project. This is actually us looking out for city finance, for local taxpayers, and asking our telling our elected representatives what we need in local government to get the job done locally. And in fact, every year Duluth adopts a legislative agenda of the items the city will lobby for. And in light of the resolution that was passed in December, the City of Duluth legislative agenda now includes the Minnesota Health Plan as an official item on our city's legislative agenda. So,
Yeah,
and we got the unanimous vote, which was great. That's just a short version of what we did in Duluth. Happy to answer any questions or share any further insights.
Yeah, I'm really impressed. I'll just chime in here because I have the I have the Zoom in my hands. Anyway, I zoomed in to the council meeting, your council meeting, December 6th, and I was impressed by a few things. The simpatico between the testifiers who you mentioned, the business owner and such, and the council members like you and Gary Anderson and the others, that it was a shared, there was no barrier between, no holding back between the testifiers and the council members. And that's very heartening, how open it was. And Gary Anderson disclosing his personal healthcare finance issue. The other thing that I was impressed with and what you just reiterated is just making it basic finances, and that we need fiscal conservatism. So it's hard for me to understand how a fiscal conservative, regardless of party, could dispute the dire facts and figures.
Yep.
Anyway, that's just my input. So
Yep.
I saw that Judith Moore had her hand up.
Right. Kelly and I met with each one of the council people, and we had in the original resolution the part about the insurance companies, and we were forced to take that out. Nobody on the council was going to deal with that thing. We're sitting right on top of United Health, and they I mean, there are a lot. There's 48,000 people that work in the insurance industry in Minnesota, but in St. Louis Park, we're sitting right next to a massive amount of those. So that was one thing we had to take out. The other thing that Joel has said very well is the amount of the finance part of it. Well, we went through and we had 8% of our city budget as on health insurance. It wasn't as big as bang as it was for Joel. So we had two things that we were dealing with that we just didn't get the same amount of buy-in from the council. Those two are very important points, but they weren't for us.
Yeah, that's really tough when you're up against the representatives of health insurance right from the get-go. That's.
Can I ask you a question about that? So this was St. Louis Park. Duluth has a big United Healthcare facility in Duluth, and of course our two hospital systems are like I think just about the biggest employers in Duluth. So we've got a lot of healthcare interests in Duluth, and that did not, in our case, dissuade counselors from taking a really strong position on this. So I'm just curious, what in St. Louis Park, is it like literally the case that the councilors in St. Louis Park didn't want to
They didn't want to touch it.
step on the toes of the healthcare industry?
They did not want to touch it.
That's really interesting.
Right. So we had to rework the resolution and take that out and bring in some other points, which we
Okay.
did. But those 2 points are they're the biggest ones.
So where is it at now, Judith?
Well, it is hopefully going to be part of the legislative priorities. We're hoping for that. It was brought up, and I think it's going to be made part of that. And we think that we have one council person, she's already brought it forth during the meeting. So we think that she's going to bring forth a resolution. So we have the 2 things, the resolution and the part of the legislative priorities. And I think we're going to win on both, but it's going to be a slow process. I mean, it's not right around the corner. One of the things that we ran up against is that during the last council meeting, Hillary's there. I mean, they had a resolution about the climate crisis, and it was the same night as the mask ordinance was up, and it was taken over. The meeting was taken over by very, very hostile people. And I'm wondering how soon the council is going to be ready to tackle another resolution. I mean, they were really banged up. I mean, these people were rude, aggressive, offensive. And I kind of escaped from it because on the way in, they were standing right next to the mask required in this building. And I said, you need to mask up. And they told me to shut up and mind my own business. So
Yeah,
it was a tough group.
I know. Yeah, we don't really need that on top of what the work that needs to be done for, healthcare finance reform. It sounds like it's pretty tough. What's interesting is that what you said about the resolution itself and the legislative priority for the city of St. Louis Park. And I think I saw something on that earlier, that the city has to work with legislators on, well, probably like with all cities, they have to work with legislators on their issues.
We have our own lobbyists. We have our own lobbyists in St. Louis Park. We pay them.
Yep. Same in Duluth.
Same in Duluth?
I have a question. Can I go back to the Duluth presenter? This is Carla, and I'm talking about the city of Maplewood down in the Twin Cities. And I'm wondering how you got the resolution on the agenda. We cannot even get it on the agenda. And the second part of that is we're having difficulty finding out exactly what amount of money is spent on healthcare. And I'm wondering, we don't even have a public questioning at the end where we could bring it up and ask the question.
Yeah.
So it's very difficult.
The key thing is you need to find at least one member of your council to be your advocate, because that items to be put on a city council agenda either needs to be put on by a city councilor or by the city administration. And so me and a fellow councilor were the ones who put it on the agenda. So I think step one is always to reach out to your city councilors and identify who's going to champion this. In part because they're the only ones who can put it on the agenda. And then also in part, while your city administration may be reluctant to give you that budget information, they're going to be much more likely to give it to a city councilor who says, I want the numbers on what the healthcare, what percentage of our budget is going to health benefits.
We went directly to the city finance person, and she was very good giving us the information. We didn't have to go through the council at all.
Yeah.
We got the finance right from the finance person.
Yeah, I think it depends on like the attitude of your city administration and your city finance people.
Yeah, we're not getting that. We've tried it. Ask Don. Don has tried it. And our city council people do not put things on the agenda. They come from the city manager. And so it's very difficult. And to think that they drop the public questioning at the end of the meeting or the beginning, that tells you where they're coming from.
I guess the only answer I have is they have a legal right to put something on the agenda, and hopefully one of them will be inspired to do it, because city councilors have a legal right to put something on a city council agenda.
Can I cut in on this? My dad always told me you have to have a second. If you can get a council person and their second to work on this, then you might be able to get your administrator to put that on the agenda. But you can't just have one voice in the world. You gotta have somebody that says, yeah. That, I mean, I came to this with Roz, and I knew Joel would make it in there. At first, I brought it up to Gary Anderson, and he had problems. He said he had too much on his plate. He couldn't move this forward. So I came in there with two good people that are going to work for me, and then I could start doing some other things. So it'll work the same way with that administrator, I think, if you have two people that is respected and their council members that say that we need to get this on the agenda, it'll probably happen.
So
Thank you, guys.
actually, that's my question. I'm Catherine, and I'm here for the Northfield
All right. good seeing you,
contingency.
Catherine.
Yeah, Steve couldn't make it tonight. And I'm wondering, Joel and Juliana, how did, when you were approached to become champions on the councils, I mean, was this something that was already easy for you to, or what was the best, what really reached you to say, oh yeah, this is worth fighting for?
In my case, I've been fighting for this for like decades.
Okay,
It's very personal for me. I've been part of this movement for a long time. And it became even more personal for me about 7 years ago when my kid at age 17 developed type 1 diabetes. So,
yeah.
and I think
Okay.
Roz was really committed to Jerry. My impression is Roz was just immediately like, yes, I'll do it. Right.
Yeah,
And then Roz reached out to me. Roz was now relatively new on the council and I'd been on for a long time. So Roz reached out to me right away and said, do you want to work with me on this? And I was like, of course. So it was a very easy sell. It's more difficult if you've got to win someone over.
Yeah, thanks for the question so far. I see that Hillary Mesty, also of St. Louis Park, has her question. But after she asks her question, I would suggest that we move on to hear from Juliana from Osseo. And then we can continue with the questioning, but I don't want to get too far into the evening without hearing from Juliana. So yeah, please, Hillary, what's your question?
Hey, I was going to say with our resolution, Judith Moore, who spoke earlier, and my resolution, we really, St. Louis Park sets itself up as being a leader on diversity and equity. So Judith really put that together in our resolution that because that's our big goal as a community, I mean, as a city, that this, I mean, the diversity gaps are the main reason we are so abysmal in our medical outcomes, is because of the diversity, lack of care for people of color and poor people. So that was one issue that we wove into ours that was pertinent to our city. So anyway, that was one thing. But another thing Judith and I've been talking about, and it's great to have city council people here that can help us think about this. But we were wondering, just this last week, Larry Kraft, who's a council person from St. Louis Park, had worked out a coalition of council members across the state who declared a climate emergency last Tuesday and Wednesday. And it was in the paper on Thursday that there were 16 new cities that had declared the emergency, and there were 4 that had declared it earlier. But his vehicle to do that, and I thought, I wonder if he got this information from us, because we had met with him last summer or in the early fall. His thrust was to highly influence the legislature. So he wanted to get this out before the legislative session started, which he did. But his vehicle for doing it was that inter-council of council members or the statewide council
Mhm.
members,
Yeah,
whatever that thing is, it's like a statewide committee.
yeah,
He used that as his vehicle to get that done.
Yeah.
So I'm thinking, well, Judith and I were talking about it. We thought we have to see if maybe there's a way for us to get access, like the one woman that is our big supporter. I mean, she's super busy, so I don't know, but I think she's on that membership. And so we're hoping.
It's a different group, Hillary. It's
Yeah.
the League of Minnesota Cities Improving Local Economies.
that's,
It's a little bit different.
I would,
It's-
I would
It's
say,
it's another group that we could.
I would say this though about that, because I actually went to one of their meetings, Larry's meeting, because Duluth also did a climate emergency last spring that I was involved with. And I think you're making a really good point. One of the reasons that happened so fast is it was peer-to-peer organizing
Right,
among local
right.
elected officials. So maybe one strategy to accelerate the passage of these kind of resolutions is that if there was like a group like Larry put together a small group of city councilors from around the state who then like reached out and lobbied city councils to do it. And I think that could be a really
Yeah.
good model for this, is to like see if you could organize a leadership team of local elected officials to reach out to their peers and say, we want to get a whole bunch of these passed this year.
Yeah, so
Sounds
what
like a
you're
very
saying,
powerful
Joel,
strategy.
what you're saying, Joel, is, excuse me, what you're saying is that council members who want this don't necessarily have to wait for their whole city council to pass the resolution. They can already be networking with other council members to build up this consortium or whatever.
And that's
Whatever
exactly
we
what Larry
call it.
did. And that's how they
Right.
got all those.
That's
city
a great
councils to do it
idea,
simultaneously.
strategy.
Yeah, well, that's it. Once we read about him and having done that, we thought, well, gal, if we could do that, I mean, if we could figure out a network to do that, we could make this happen much more much more quickly.
Yeah. And John, I'm just wondering if there's a critical mass of council members, whether they're from councils that passed the resolution or not, if this critical mass of council members did approach the Minnesota Association of Cities or whatever it's called.
I think there are different subgroups in that, Don. I think there's different groups within the council. Like Margaret belongs to the economic group and Larry probably belongs to an environmental group. So there are different groups within that statewide group.
Right. And the League of Minnesota Cities, I don't believe ever has formally endorsed the climate emergency initiative. They just use that, I think, as a networking opportunity. And it doesn't have to go through League of Minnesota Cities,
Yeah,
because I mean, counselors tend to have connections with other counselors. That's how I connected with Juliana. She knew a couple counselors up in Duluth who connected her to me, and then we were able to network. So if you can get a critical mass of counselors on board, they know how to do this kind of organizing. You don't have to do it for them if you can motivate them to want to do it
yeah,
themselves.
because they're of your commitment that this needs to be done. And so that would be the motivator.
Yeah, use your connections. Mary Murphy hasn't signed on to the Minnesota Health Plan, but I've got a contact who is a good friend of hers. I know her, but not as well as he does. And I pretty much can guarantee that she's going to sign on to the Minnesota Health Plan. So use these connections. You build up these networks. They don't have to be in the council, but they do network. They do know each other and work those connections, and that'll get things moving.
Yeah, and we've already seen that with Joel testifying at the ASIO, helping Juliana with his testimony as a city council member from elsewhere. So yeah, this is really a great discussion on an exciting potential strategy. So why don't we hear from Juliana now? And Dave, would you like to give her your introduction?
Yes, I can do that. First of all, I'd like to say this networking, that is a big key. And that's pretty much how I functioned and got this going here. I knew Juliana about 4 years ago when I first moved here, was introduced to her through a mutual friend who was in Indivisible with me. And Juliana was running for city council right about that same time, and met her, and we became friends over the years and talked about politics and such. But what I've really learned since taking up this resolutions thing is how the networking can really blossom. And Juliana happened to be from the Duluth area, so she basically knew a lot of people up there well enough that she could communicate with council, and ran across Joel, and so it just kind of dovetailed from there. And I've been working on Juliana for several years with this healthcare and getting her interested in it. And I think she kind of got sick of it after a while, but eventually it kind of kicked in. And I happened to have moved here and moved into a building where my neighbor was another city council member. He is a little more of a middle of the road guy, but he was all about affordable housing. So I knew there were some potentials there. But every time I talked to him about single payer, it was like, I don't know if it can be done. And Juliana kind of took it up with him, and I think it was December, and just started talking to him about it, because those two are very close on the council. And she convinced him that this is kind of a legacy thing. And, he's older, he's not going to be on that council a lot longer. And he bit into it big time. I brought him over John Marty's book, and he read that thing in a couple days, and he was on board. So that's the way it kind of works. And we had a third city councilor who was our newest one. She's been on for a year, quite progressive, and we both felt that she was almost a sure thing. That's 3 out of our 5. So we kind of knew going in, we got this. And the only thing I would add is I kind of wanted to get more. I wanted to get those other 2 conservatives. And I really went in swinging on my testimony that this was a fiscally conservative thing to do. And as a taxpayer, I don't know why you would want to cling to a government-run program that is subsidizing for-profit commercial insurance at a much higher rate than you could do yourself. And as much as I tried, it didn't work. It didn't get either of them, and she kind of predicted it. So
Well, it works on me.
yeah. So anyway, I would just want to introduce Juliana Holstrom is my champion on this. She did a great job, and between her and Joel, it just flew. So Juliana.
Thanks, Dave. Thanks, Joel. It's nice to be with you. I'm going to tell you how it happened in Osseo. Yeah, Dave's been on me for quite a while. And I kept telling Dave, I just don't like the word Medicare for all. And you want to call it healthcare for all? I'm all in. Well, I was at the December meeting, and I listened to Jerry, and I listened to what went on in Duluth, and I called Dave and I said, hey, I've got 4 weeks off. Let's get this on for our first meeting in January, and let's get it passed. I said I would go to my other council member and get a co-sponsor, and that's what you have to do. In Osseo, our city administrator can put something on the agenda, or our mayor can put something on the agenda, or 2 council members have to decide to put something on the agenda. And otherwise, it doesn't get on the agenda.
Hmm.
So I found my co-sponsor and I told my administrator that we were gonna do this for the first meeting in January. And I worked with Dave, I worked with Joel. The 3 of us met together. Unfortunately, my co-sponsor had a lot of health conditions, and unfortunately, the night after we passed the resolution, he ended up having a double bypass. So I think that my advocate, Dave, kind of wanted to take his time and really get the others to buy in. And I said, no, we got the votes. We're going ahead with this. And so that's what we did. Joel really helped us. We used Duluth's resolution to pattern ours off of, template ours off of. Dave had gone to city administration. I had gone to city administration in June, trying to get the numbers. And I made a phone call to the city finance guy, and within 5 minutes, he was calling me back with the numbers. So you just kind of have to keep on these people because that's public information. So any numbers you want to get, a city administrator, a city finance person, Osseo is small, so we don't have a lot of staff. They have to give you those numbers, whether you go into City Hall with the request, whether you call them, email them, they have to give you those numbers. Sometimes you might have to work them a little bit like Dave did to try and piecemeal where things lined up for us. But that information is public information. Now, as I hear the League of Minnesota Cities brought up, and Representative Mary Murphy, believe it or not, Jerry, I worked for her campaign when I was in high school in 1980. And she's still a good friend of mine. I met her at the rest area on my way to Duluth, and I'd have no problem contacting her too on your behalf and putting a bug in her ear. So I think that Joel really taught me and showed me that cities working together, council members working together. But I made the suggestion to Dave, and I'd like to work on this. I'm very active in the League of Minnesota Cities. I've been commissioned, and everything I've ever applied for whatever reason, they've given to the little city councilor from the little city of Osseo. And I've worked really well on HR, data practices, nominating committee. I've been asked to run for the board. I'm not a board member kind of person, so I've declined that, but I've seated 3 boards now for the League of Minnesota Cities. I've worked with a lot of attorneys. I've worked with their lobbyists, and I said to Dave, next summer, their annual meeting is in Duluth, Minnesota. I am first to register. I've reserved my hotel. And I said to Dave, let me talk to my people at LMC and let's see if maybe we can even get a breakout and we can get a group of people to gather together and make a breakout session and talk about healthcare for all Minnesota and make it a breakout where those that are interested can come and listen. Maybe it'll attract those that are just curious and maybe it'll even convert some people. But I want to try and work on that to see if we can get a breakout for the annual conference, which is June 24th through 26th in Duluth, Minnesota. And of course, Joel, you know, I'm going to be calling on you and Roz, and I'll probably ask Renee and everybody I know up there, Eric. Unfortunately, Derek, who you've spoke about as the small business owner, I just see that he is resigning. February 14th is his last. He's more of a conservative voice, and you guys got him. You guys got it unanimous. We didn't. We got a quorum. We got it at 3-2, but like I said to Dave and Joel, we got the win, and that's what matters. Osseo was the first small city in the state of Minnesota, and that's how I sold it. We're the first small city in the metro. We're the first small city in Hennepin County, and we're the first small city in the state of Minnesota. And people take note.
And you beat us.
And
You guys in Osseo, I watched the video of that council meeting. You are never going to get that mayor. I went on the television and I watched his interviews and stuff. You're never going to get him. The conservative who gave this long reason for not voting on it, if he was true to what he said, he should have abstained because he didn't have enough information.
Yeah.
But he voted against it. You were never going to get him either. So he did as well as he could have done.
So Juliana, can I ask you a question about that? You know,
Yeah,
you know,
sure.
you told us we never get those two, and it was obvious at the meeting. You could just read the room. We were never going to get those two. And they're more conservative than Derek. I mean, Derek's not as conservative as some people think he is. But I still think, and I wonder what you think of this, that like the fiscal conservative framing, I still think it had an impact on them, because what didn't happen that I know you were a little worried about and I was a little worried about, they didn't push back. They didn't trash single payer healthcare. They didn't say this was a bad idea. They you know, the mayor didn't say a word. And the other guy basically said, you know, everything you're saying makes a lot of sense, but I don't have enough information to vote for this, so I'm going to vote no. And so there was like not a bad word or a contrary word or an anti-word out of either of their mouths. And I'm wondering, to what extent do you think, I mean, if we'd framed it in like more of a partisan way, would we have gotten more pushback from them? To what extent did we like just chill them out a little bit by the way we framed it? What do you think?
I think that we came in and blindsided them.
Okay.
And those boys don't like this girl that came from nowhere and started breaking up a good old boys club is
Okay.
what I think. And I told you and Dave the Saturday before that I'm not even going to worry about those two.
Right.
The one that you're speaking of, the council member, he talks in circles and drives me crazy most of the time. He'll never get over that he was the incumbent, that I beat him pretty bad in the election. So, you know, he's got to get over himself to start with. And if people start to learn about it, that's the thing. If they learn about it, they'll realize it's not a partisan thing.
Mhm.
You know, Osseo is small. We're nonpartisan. Or so we say. But there's certain things that I'm more conservative on. Healthcare, I gave my personal testimony. My co-sponsor gave some facts and figures on his issues. And we had a lot of the community backing us. When we had our meeting Monday night, we had community members speaking for matters from the floor, thanking us for putting this through. Have I got my legislature behind me? No. Ryan Winkler called me twice last week. I said, Ryan, you gotta learn about this. You gotta learn about this. it's not something that, you know, you hear the word Medicare and yeah, he was the same as I was to start with. And I'm sorry, Dave, you've heard this how many times from me? But when you sell it like it is, that it's healthcare for all, it's just, it's equitable, and you start with the cities. Once you get some of your city council members and your cities to pass these resolutions, people like myself, like Joel, we're willing to work with other city council members. I know city council members from across the state because I have been active in League of Minnesota Cities. So I don't have a problem putting a bug in their ears. In fact, I left a local group for Northwest Hennepin. I was a council member. Most of them are mayors. And as I wrote my letter that I was no longer going to be a part of this, I said, here's where I'm spending my time. And if any of you want some information, please be in touch. I'll get an advocate out to you. I'll speak with you, whatever. But I think we have to keep the ball rolling amongst city council members, you know.
I mean, could I, this is Carla, and I hate to interrupt, but you're talking about the League of Minnesota Cities. And I personally called that office several times, and I finally was able to give a message, and they must have some kind of a public events or legislative person there. And I asked about healthcare, that if they had maybe something coming up where we could give a little presentation or inform people. And I got a call back from the lady, and she said, we do not hear anything from the cities about healthcare. So I reported that before. So I don't know who you're talking to, but maybe better have a discussion. They only got a few people in that office. So they're not.
Oh, they've got a lot of people in the office. It's just who's available and who's willing to talk to the public. They're a lot more, they're there to be resources for cities. And there's 835 cities, I think, in Minnesota that are members. And if I make a phone call, I get an answer, whether it's immediately or within days, or it's an email, I get an answer. So I think that, you know, there's a possibility that maybe it'll fly, maybe it won't, but it doesn't hurt to ask, and to keep networking with other city council members. I said to Dave, you know, we're looking at going after Brooklyn Park, Brooklyn Center. I know some council members in both of those cities, and Dave does as well. You know, once we start talking and networking between council members, I think that's what got the ball rolling. Personally, again, I'll say, I was here a month ago listening, and that's when I said, hey, we can have this done by next month, right, Dave? And Dave's like, yeah, sure. Well, even Dave was getting a little nervous towards the cutoff date, and he thought we needed to bring in heavy hitters. And I'm like, nope, we're going to blow this through. Well, we got the chance. Well, we got the votes. We're going to take the win, and we're going to grow from there. So I think that, you know, Joel, I can't thank you enough, because your passion really came out in Duluth's presentation and their resolution passage. And it just resonated with me. You said you were going to temper it, but I wished you would have given it all. I think that you could have made some head spin in Osseo, but I just think that that's what it's going to take. And we work together very well. And I think that the two of us can work with other cities very well, continuing this momentum. And I really think the connection is, if you're going to work for cities to get this resolution passed, Then you have to network with council members. And like Jerry said, he's looking at St. Louis County. You know, hats off to you, because there's another entity. And I said, we can look at the Osseo School Board. We've got enough voices there that I think that's another big place, because I think what's going to resonate with them is the cost of healthcare for all their employees. So there's a lot of areas that we can look at, we can investigate. I'm going to do my darndest to see if we can get something in June with the League of Minnesota Cities. I'll work with the people until they've told me no in every direction possible. And I might still bug them after they've told me no then too. So I don't give up easily. If I did, I wouldn't have lasted my first year with 4 men that were always opposing me. So I think that that's the way to go about it. I think that we can make the metro area, outlying Minnesota, small cities, big cities, we can make it happen if we all band together. And there's a lot of really strong voices in this group, in HCAM, in physicians, nurses association, all the groups that Dave's got me involved with. There's voices there to speak to the communities, to speak to the cities, to speak to the counties, whatever boards. And, you know, I can certainly make my email available, and don't hesitate to email me or call me. And, you know, if you want some help, or I can be of assistance, or Joel and I can tag team, we're there to do it. And it's a fight that it only makes sense. And the more that you educate people, no matter what side they're on, if they take the time to learn, then it's a issue that impacts everybody.
Yeah.
Yeah. Thanks, Juliana, for the scope of the organizing that you laid out that's needed. And I know myself, I just been, of course, kind of focused on the structure of going to city councils. And what you and Joel have brought up is this other dimension, this other track. So right now I have here, it looks like a 2-track system to keep working and going to city councils for their endorsements, but also work with what you just laid out, networking with other council members regardless. So after the meeting, if you could just share with emailing to me and others more thoughts of this second track, dual track of networking with other city council members. And I see that, well, Hillary, your hand is up, and then I see Catherine and Carla's again.
I think
And
No, I'm down.
Email and phone number in the chat for everyone too.
Oh, good. That was my question. I was going to, I sent you a direct message, but I wasn't sure if you'd read it. So I was asking if you would give us your contact info
Mhm.
for us to share with our, our lead advocate on the council. That we can maybe make a connection there.
I'm gonna have to look in my book. I think I know, I'm reading these chats here. I think I know a council member in Woodbury, and I think I know somebody in St. Louis Park, but I'm gonna have to look at the book. Sometimes I get cities and council members mixed up, but the email I'm gonna put in here is my personal email, not my city email, because I don't need anybody coming at me to read or subpoena my city emails. But feel free to contact me by phone, by text, by email. And I'll be happy to work with whomever, wherever. And again, I credit a lot to being good friends with Dave. I mean, Dave's like family to me. And Joel coming on board and having the support of his his sponsor, co-sponsor, Roz. She wrote us some things that we were able to use and sent her support as well. And I think that's what it's going to take, is just continuing that support. And don't be scared by the phone number. I lived in Arizona and I brought the phone number with me. So.
Yeah, thanks, Juliana. And yeah, what you just, how you expressed yourself in such a caring way, that's a bonus for all of us. That's what's going to carry us through, is a mutual caring for, arriving at the same goal. And I really love it.
I can just jump in. I'm gonna need to go in a few minutes. But I appreciate the opportunity to be here. But if anyone has any like final questions for me about the Duluth stuff, I'd be happy to respond, and then I'm gonna have to run.
So Joel, before you leave, regarding the second track that we could be moving in, the networking, is there, have you thought of any structure for that?
I just say, just off the top of my head, because I haven't really thought about it, but it would seem to me that if you could get a relatively small group of highly committed city councilors that's regionally diverse, like a 5 or 6 person like leadership team, they could then take the ball and run with it and do like some statewide outreach to their council colleagues.
So would you and Juliana be willing to be part of this smaller group to do more strategizing? That Dave and I and others can work with you?
So what I need to say is like, since I'm no longer in office, I shouldn't be a member of the team. And I'm happy to maybe do a little bit of brainstorming, but to be honest, I didn't run for elections. I need to like reclaim my time, and I'm being very careful right now about what I commit to. So I'm happy to help a little bit, but I can't at this point commit to be part of an ongoing team.
Thank you very much for sharing all that you gave us tonight. It really, really helps.
I
You're
think
quite welcome. Thank you all.
go
For
after Proctor, Hermantown.
What's that?
Okay, Proctor from
I'm
my.
sure we could get this through Cloquet. We've got contacts on the Cloquet City Council, and my sense of that council is that we could pass this easily.
And
So
I've got connections in Proctor.
Yeah.
So do you think a month from now for the February meeting, we could have something more solid to present to folks on this networking track? Anyway, I'll just keep thinking about it and talking about it with folks.
And I think Dave and I'll discuss it more too, and I think we can build off of it.
Okay, great. All right.
Thanks, Joel. It was nice to
Thanks,
see you.
everyone.
Yeah, thanks, Joel.
Bye.
Thanks,
And
Joel.
so who wants to go next, Catherine or Carla?
No, I don't have one. Thank you.
Okay, Catherine.
Yeah, I was struck by the phrase, we need to get people to learn about this. And one of the things I mean, this is kind of a general question, but when we're getting people to learn about it, is part of that have anything to do with Senator Marty's huge expose on pluses and minuses, or are people really finding that the biggest success just comes from the points that have already been discussed, you know, city budget, unfair distribution, that kind of thing, without actually showing them a working plan? Or is showing them the working plan, is that going to cause problems or is that going to help?
Well, I think that the plight of the city budgets, which should probably be pretty universal in the state, you know, that creates the reason, and the solution really is what you know, needs educating. And we just last fall, going into winter before the holidays, Kip Sullivan did the 3-part webinars and then the wrap up before Christmas. And that is designed to educate constituents, to talk to their legislators about the real cause of the problem, that we're in a mess, we're in a healthcare spending crisis, the managed care under different guises hasn't worked for the last 15 to 20 years. I mean, that's all laid out. And so there is the content. It's just for constituents to learn that, to be able to talk to their legislators. And so that's I think that's an upcoming challenge. We haven't really, there's a lot to be said, but it has to be kind of distilled to what is most understandable and what can be most easily, readily expressed by constituents to legislators.
Right, I
Um,
mean, do council people say, well, who's going to control it? How are the funds distributed? I mean, do they start getting into the nitty gritty from that other angle, or do they just listen to us talking about the problem?
Yeah, I'll let the others answer that question, who have had some conversations by now with their council members on this. So what are council members asking about the Minnesota Health Plan, if anything?
In Osseo, we didn't get a lot of questions. One thing, I have a close friend in St. Paul, and I picked their brain a little bit too before going into this. And the biggest thing in St. Paul was that going into the pandemic and so many people losing their jobs, their healthcare was tied to their employment. So not only were they finding themselves unemployed, but then they were finding themselves without healthcare or the means to continue that through a COBRA or whatever. So you have to kind of look at each city. You're going to have to kind of study what's going to be the PowerPoints that you want to bring up there, that's going to resonate there.
Yeah, you're right. Cost containment. These cities that are hard pressed, they can no longer afford the rising healthcare coverage, the premiums for their city employees, and the current system, for going on too long, has not shown to be cost containing of the extraordinary rise in costs. It's going to be $94 billion by 2026 in Minnesota, more than housing and transportation. So if that doesn't say we're in a crisis, nothing will. And so one of the basic, I guess the basic fiscal point of the Minnesota Health Plan is cost containment, and to just say how it's going to contain costs.
Right, but we're not providing a specific thing like for such and such a city. Under this program, it'll only cost this much compared to what you're paying now. It doesn't get down to that.
We did that in Osseo. Dave worked the numbers and we did that in Osseo.
Yeah.
Jerry, go ahead. I see that you want to speak.
Well, remember, we've got a seed that's latent that nobody can see. And it was obvious when when we watched through the Duluth City Council meeting. Everybody knows that this healthcare system is broke. They don't all speak, but they've got problems of their own. They have family members that have problems. Everybody has this, and it just popped out. All these people on the city council, it just revealed all this as it
Yeah.
happened. And what Joel pointed out, and Osseo, why there was no pushback is because of that. They have family members. They've done these things. They're trying to stay with their group,
Yeah.
but you can't say anything about it because deep down, they know the system is broken.
Yeah.
And
Yeah.
you're not gonna, nobody sees that. So when we go in, the key is the network. I'm doing this at the St. Louis County level right now. And I was looking for my second. The guy I know that should be voting for it said he would support any petition, but he would not sponsor a resolution. So he's a yes vote, but he's not going to be my second. And I had a devil of a time getting my second guy to respond to me. So networking, I found a guy who knows him really well, who's got his personal phone number. And he said, yeah, here's Jerry's number. Call and talk to him. And he's going to co-sponsor this bill if I come up with one more commissioner, which will pass the thing easily. So the networking thing is, you're just a voice in the crowd and you can get ignored pretty well. But to have somebody just in this meeting, I found out we got networking people that are from Duluth, from all over. You need that one person just to get you in the door. And once your foot's in the door, you've got the seeds are there. You just got to get in the door and get it and work the system and work what everybody is saying here. Find the niche that's going to put it over. But you got to get your foot in the door. You got to network. You got to get in there. And once you're there, you can move it.
Yeah.
Even our conservative Dave, what was his line? The healthcare system needs a lot of love.
Yeah.
There's too much information for me to get through to give you a vote tonight, but the healthcare system needs a lot of love. So, that says to me that there's still that point that no matter what side they're on, no matter how resistant they may be, you gotta hit that point. You gotta hit that, the personal testimony. My personal testimony maybe had some influence. I was given a cancer diagnosis, and because my insurance company and the U of M or U Healthcare couldn't form an agreement, I was told that my dermatologist wouldn't see me just days, weeks before my appointment. By the miracles, I got in with another healthcare network and saw somebody 5 days later than my original scheduled appointment and received a stage 1 cancer diagnosis. Had I not pursued that, if I had waited, that probably wouldn't have been a good thing. And it probably wouldn't have been a stage 1. So, people have testimonies like that. Jerry found that in Duluth. You had healthcare workers, you had public people speaking in Duluth. The problem with Osseo is we're on WebEx, we're virtual, we're not meeting in chambers, and our administrator doesn't realize what they realize in Duluth, that you can get public to speak on it. So for those of you going into chambers, you're face to face, it gets more confrontational. On a virtual WebEx meeting, Duluth ran smooth, and that's where I said to Dave, hey, we can do this. We can do this next month. We're going to get this done. I don't think he quite believe that I was gonna push it through as fast as I did, but we did it.
There's another area of, thank you. There's another area of organizing potential, and that's the allies that a couple of HCAM folks are organizing. Of course, you know Rose Roach of M&A, and then there's Ken Engelhardt. He's retired from the Veterans Administration in Minneapolis. And they're co-chairs of what's called Coalition Builders. And they've, for I think like 5 or 6 meetings now, beginning last May. And we had the last one just last week, might have been like the 6th one. And there's representatives of organizations, associations, unions that are probably about 18 or so. Representatives of 18 different organizations. And when this comes together more, that would be another source of people power, where these organization representatives or other leaders of these organizations could also, and the members themselves, the rank and file, wherever they are, could take on this city resolutions for their cities. And so I'll bring that up as well at a future allies meeting, because there's a lot of potential there.
And maybe go after the unions. You know, somebody in a sheet metal union in the cities is paying over $1,500 a month.
Yeah.
For a single person on healthcare.
Yeah.
You know, maybe you need to start looking at going at the unions.
Yeah, we are.
Rose
In fact, Rose Roach is going to be speaking to the International Brotherhood of Electrical Workers that one of our COAC members got set up for that meeting. That's going to happen sometime in February. And Rose has put together kind of a template in talking to unions on regarding how much better off union members would be financially if they didn't have to keep negotiating, just like business owners, just like what Kevin Brown said yesterday at the rally, that so much more could be going into the business or into the union members' pockets if there wasn't the takeaway of the god awful health coverage. So yeah, there's a few directions to go into to get more people coming in.
This will go a little bit back to networking again. For those who get a chance to get a testimony from people, I wanted to line up a union person to speak to the issue. And I had Chris Rubich in mind. And I didn't contact him. I contacted Rose Roach because Chris is a member of the local nurses union. And Rose is like God for the nurses union. And I had God speak to Chris Rubich. And if you watch that testimony, Chris delivered. Not only that, when he went, he's a member of SD7 in the Democratic Party. I think he may be the chair. And he made a resolution at that meeting after Rose talked to him to bring up a letter to the editor from SD7 supporting healthcare or Minnesota Health Plan. So when you network and I could have done it, but I wouldn't have had the impact. And I went to the strongest person to deliver that message. And the nurses unions are all over the state. And if you have a testimony that you want to get a union person, send an email to Rose. She'll find the best person to deliver it in the union, in that local union, to make the best impact. Rose isn't going to do it for you unless she's in that district, but she'll find somebody in that union to deliver that message for you.
Rose has recently moved to Woodbury. So she is in our district right now, but we were kind of working on Marine, but that's kind of on the hold now. So I think we'll start organizing. And we have
Marina-
other nurses.
Roy, don't take it too personal. League of Minnesota Cities a couple years back, it's never happened before, but they had an administrator and a council member both running for the board. There's never been one city that's had two people running for the board. So for a little city, they've got some issues amongst themselves. So don't take it personal that it didn't fly there. They probably need to get a few kinks worked out of their own
Yeah.
system there.
So are you familiar with the council from Marine?
I do know a member and I knew their administrator. I don't know if they're both still there.
Yeah, I don't know about that. I know a couple members, but anyway, thank you all. I'm gonna have to leave
Yeah.
here.
Yeah, thank you. And I will, I see Hillary's hand is still up.
I wanted to, since we're kind of winding down on the conversation, I wanted to make sure I got this in too. That I want us to create a group that can approach Marion Green, who's the chair of Hennepin. One thing being, Marion, when Judith and I were going to a meeting where we were hoping we were going to be on the legislative committee, the legislative priorities meeting. It turned out we weren't, but I called her. I didn't call her. I texted her and asked her if she would bring it up because she was going to be at that meeting as one of our elected officials. And it turned out, because of technology, she was zooming in and she could not, they didn't get her hooked up until late in the process. So she couldn't really do anything. But I texted her and actually she texted me and said, sorry, I couldn't do anything. And then I texted her back and she's saying, I really appreciate your advocacy on this issue. She is totally with us. So we just have to, and I just am too incompetent to do it myself. So I want a group of people, but I have a personal connection with her. I've I've door knocked for her for years, and not years, but in two different campaigns.
Yeah.
And she comes to all, she's, to our all of SD 46, all of our events. She comes to our annual picnic. She comes once a year to come and talk to us. She has a relationship with us. And so, she is, and she's the chair. So, and she's up for election. So it's like, we need to, not that she can't vote it in on herself, by herself, but she can facilitate it happening. And she would. So we just need to put together a group of people that can meet with her.
Yeah. So Marion Green, she's the chair of the commissioner.
Hennepin County Commissioners.
Wow, that's and you have this in with her for your campaign work for her.
Yeah.
That's
And she's very, very pro healthcare.
yeah, that's
We've got another one, Dave, on Hennepin County and possibly
Wow.
two.
so another commissioner that
Yep.
in addition to
Kevin
Marion
Anderson.
Green. Wow.
Kevin Anderson, District 7, very pro. And I think if I worked it right, I might even get my District 1, Jeff Lundy, to at least hear about it.
Yeah.
Right. And Ann Jones also has already made contact
Yeah.
just in the last couple weeks with
With
another
who?
commissioner.
Yeah, and Ann, yeah. So Wow, there's so much going on. But I'm gonna try to compile all this into minutes and get it off to you, because there's that path, there's the network council members network working path. Now, in addition to the first path that we've been working on, which is just going to the city council. So
Well, I think
Oh,
if
great.
we can get the county commissioners to go for it, that would be a huge influence, I think, on the
Yeah.
city.
yeah, yeah.
Yep.
Yes, and they have a big payroll.
Yeah.
Yeah,
Mhm.
Hennepin County has Hennepin County Medical Center too.
Yeah.
It's huge.
Well, this
I
is
find
really, really a good note to,
I found it interesting that someone from SD7 said they had to have a resolution for healthcare when single payer is top of the line on the DFL platform. They don't need a resolution. That's one
Well-
of their issues.
no, but one of their issue, I think their issue says that affordable healthcare, they don't say the Minnesota Health Plan, and they don't say Medicare for all. And a big chunk of the DFL do not support it.
That's
The-
correct, but it's not, there are two in the national plan, there are two Medicare for all plans, so they wouldn't come out for one or the other, and they wouldn't come out for Minnesota Health Plan if it didn't go through the legislature. But to get affordable health care on the platform, and there will be plenty resolutions this precinct caucus that'll probably get approved.
The-
It's
the-
in there.
The resolutions for the DFL, they have a resolutions committee. And they condense all these resolutions, and that committee can make that resolution from a strong resolution down to we support single payer or whatever they
Yeah.
want to do. They can make it, get it down to about 4 words. And the legislators we put in or endorse, this is, yeah, okay.
Yeah,
It doesn't mean it's a good thing to point out when you're having a discussion within the parties. It's part of our platform. So if there is value there, but it's not going to do anything for us.
No, I get
That's
that.
my
but
personal opinion anyway. I
well,
mean,
yeah, it's one lever, like you said, Jerry, in conversation. Oh, by the way, if we can get it as an action, one of the, I think it's about 6 action agenda items, if we can get the Minnesota Health Plan specifically, that the DFL supports enactment of the Minnesota Health Plan, that would be of some help.
Right.
And HCAM, if it hasn't been done already, HCAM is getting out that resolution on their official 2022 form.
if that's important to you, I suggest you go to your caucus and get on the resolutions committee. So when they start condensing this stuff down, that you can put your 2 cents in to get the right language in there.
Yeah, I have a question on that, and I know that we should be adjourning pretty soon, but it's just hard to let go of. With the virtual meetings now, I think most of the precincts are going to be virtual. I know mine is. So what's the process of resolutions being voted up or down, like at the in-person precinct meetings?
They're
At the
all, they're all going to pass. They're all going to be submitted to the Senate District Resolutions Committee.
Right.
Okay, well, that's good to hear, because with we have like, I don't know, 5,000 in our data bank. It's going to be going out on the every action platform that Judy's going to send out. And so it's just a matter of the caucus member just clicking and sending the resolution on to to the resolutions committee or wherever it goes.
just to the Senate district.
Yeah, okay.
And there's something new now. It's a couple of years back. it has to be passed by so many congressional districts before it goes on to the state. So
That's correct.
we could all pass it in Hennepin County, and if it wasn't passed in, you know, if it wasn't in 05, but if it wasn't passed in 2 other congressional districts, it's not gonna go anyplace. It's
So
gonna
that's
go push.
Correct.
Yeah, it's great to have the statewide coverage.
You know, prior to 2018, I think that the Minnesota Health Plan was one of the 6 action agenda items. And at the 2018 state convention down in Rochester, Ann Jones and I, we flyered and met with probably half of the delegates there. And they all said, you know, we just had quick handouts and quick, you know, just a quick delivery on that, a wrap on it. And I think it felt like we talked to like half of the 1,000, just handing out the resolution and then our little wrap. And so, you know, it did, I think, get it on the action agenda. And, you know, it's some help.
See, now that's where I have an issue in, it's my own integrity, but I'm a nonpartisan candidate. So I've had to temper myself as far as how much I get involved with on the political side. But I'll feed Dave and I'll support Dave as he does caucus and whatever else. But again, I think that if we keep networking and maybe if we can get something with the League of Minnesota Cities so that there's some education there in a breakout session. I really think education is the biggest thing, because I know for myself, until I started learning what it was actually about. Dave approached me several times and I was like, yeah. But then once I learned what it was about and started making sense to me, then it was much easier for me to put the bug in others' ears and get a co-sponsor and get this done.
So would there be a specific breakout session on healthcare?
See, that's what I'm gonna have to work with the people that I know at the league and see if they can
Okay.
have a breakout that would be just about healthcare Minnesota.
Yeah, that'd be great. And that's going
Yeah.
to be in Duluth this June.
This June. I can't promise, but I certainly can ask. I certainly can work a lot of angles there.
Yeah.
Dave and I were discussing this just recently too, and it's like, if we're gonna look for city resolutions, if you have a captive audience of city council members and staff members and administrative members and whatnot, city attorneys, you name it, mayors, whatever, there might be a lot of buy-in.
Yeah, we could find a good spokesperson, you know, to,
It would probably be best to have like 3 strong, Rose,
yeah,
get some advocates, get
Sure.
somebody, really strong like Rose, and Dave's had ideas.
yeah,
The guy from the Small Business Coalition Alliance, he would be great for you to have, because
Yeah.
most of the cities are going to be small. I was wondering, Juliana, what educate, when you said you learned more and more about it, and then I was wondering what educated you? What was the thing that convinced you?
Dave Garibaldi got me going on, hey, there's this Zoom. Hey, there's this Zoom. There's this. And fortunately, Dave and Rosanna are such good friends that we have dinner how many times a week. And Dave's an advocate through and through.
Okay.
And And he got me into different groups and I just started learning more and more. And I'd say I've been active since about 1.5 years now with different ones.
Okay,
And most consistently over the last 8, 9 months.
like with HCAM, through HCAM, that kind of stuff?
Through HCAM. Sometimes I don't even know which group I'm in, but I'm in them all, I think.
Okay.
Aren't I, Dave? It's like,
Did you ever read the John Marty's book?
Dave got me a copy of that and it's on my agenda.
Okay, it's easy to read. I was just wondering if that convinced you, but it's easy. It's an easy read.
Yeah, that's kind of the Bible
What
of the
convinced
Minnesota Health Plan.
most is we have a broken system. We need to do something that's fair, just, equitable. And I think that looking at this from that perspective, it's what makes sense. We can't put Band-Aids on an aneurysm. It's not gonna work.
In the words of a former president, who knew healthcare was so complicated? When you lost this discussion, when you get into pushback, try the easy way. Try to save health insurance. Ask the question, what is the value added that the health insurance industry does for our healthcare?
Yeah.
Because I want to save that. Let's switch sides just for a minute, because you'll do that if you can convince me that there's something that helps our health insurance.
Yeah,
Yep.
yeah.
I mean, the argument's lost already, but that's going to really, even if they don't win it, they're going to think.
Yeah.
Of what is going to, and again, remember that latent thing. They've got a family member, they've got problems, they know it's a broken system.
Yeah, well, in organizing parlance or terms, that's called cutting the issue. What you just said, cutting through all the smoke. What
I'm
good
not
is it?
I'm not a physician. For 50 years, I repaired commercial cooking equipment. And I diagnose things for a living. And diagnosing, that's what you got to do, is you got to cut out all the things that aren't there. And so that you get to you don't want to fix a symptom. You want to fix the problem that made the symptom. So.
Yeah.
Juliana, one question about the league and approaching the League of Minnesota Cities. Do you think there's some way of getting a survey out before that big conference to cities and find out how many of them are struggling with their employee health care, paying for their employee health care? So you can kind of gin up, this whole thing.
All of that, Dave, so that when I'm making contacts, that might be and when we have these conferences, they run 4 or 5 different breakouts at a certain time, at a given time. So people sign up for what they're interested in. And sometimes if there's a lot of interest in something, they'll have it at multiple times during the day so that people can attend that as well as others. So
that might be one goal, excuse me for interrupting, but that might be a goal for the counselors networking that would be, getting going by this June. If we haven't, through this networking, again, regardless of whether council members had their councils pass the resolution or not, in this case, it doesn't make a difference if enough of them from different cities get together and want that for a breakout session topic.
And that's what I'm thinking, that, I'll do some, I'll make some phone calls and emails and connections, and I'll see what we can do with the league, because there you'd have such a, I mean, 500-600 people attend those conferences. They're all city officials or management or mayors or administrators or attorneys or whatever. I mean, you'd have the audience you need. But
Yeah.
like they had said about going after St. Louis County, I think we look at the school boards too. You know, there's the issue again with employee coverage, taxpayer dollars.
Yeah.
You know, Don, the city of Maplewood has a DFL organization of its own, and we do endorsement of our city council and possible school boards. Some of that we could push for the endorsement and ask the question, how do you stand on healthcare at a endorsing convention? That, I don't know, there are about 8 cities in Minnesota that have their own DFL.
Uh-huh.
And I think I would push that when that comes in midsummer before the primaries. That's a good, thank you. That's a good idea. I'll check that out.
Yeah, so that would be brought up at the Maplewood endorsing convention.
Exactly. That'd be one of the questions they might have to answer.
When is that going to be?
Well, we won't set it until after redistricting, because we don't know exactly where everyone will be, because we're one of the areas that might get redistricted.
Yeah,
He'll-
we could,
Are you the one from St. Louis Park?
No, I'm from Maplewood, the one that's having the most trouble.
Oh, Hillary, are you the St. Louis Park? Okay,
It's Judith Moore and I are from St. Louis Park.
okay. All right, making some notes.
Good.
So am I.
Yeah.
Is there any other questions for me? Otherwise, I think I'm going to have to take care of Dave's best buddy, my little dog.
We appreciate your thoughts on this, Juliana. It's been a big help for us.
Appreciate being part of this group. I appreciate being able to offer what worked for us. I appreciated working with Dave and Joel, and, you know, getting to know people through these different networks too. So, but
Yeah.
don't hesitate to reach out to me with any questions or issues, or if I can be of any help or guidance, or
That's
talk
good.
to city council members, or even if I don't know them personally, I'll reach out to them.
Okay, thank you.
yeah, thanks, Juliana.
You bet.
Very
Thanks again.
valuable tonight.
Have a good
Bye-bye.
night, everyone.
Bye.
Right.
Well, since she's bid herself adieu, it's about beyond 8:15. So I'm surprised that my Zoom account has lasted this long. So it's really,
Yeah.
it was a great meeting. And I think it's just adding fuel to, our campaign. And I think at the next meeting, there's going to be even more to talk about.
Yeah.
So, yeah, thanks for
Thank
everybody.
you.
And yeah,
Thank you.
yep, we'll keep in touch, and I'll get out notes, because there was some really good directions to be moving in.
Is it always the
thanks.
fourth Thursday? Fourth Thursday? Is that what you said, Don? Fourth
Say again?
Thursday? Is it the
Yeah,
fourth
it's, yeah,
Thursday?
it's the fourth Thursday. So I'm gonna look at my calendar on my desk here. And that would be February 24th.
Thank you.
Thanks, everyone.
All right, thank
Thank
you.
you.
Thank you.
Mhm, bye.
Good night.
Bye-bye.